My next guest is going to be Hunter Howard from Hormone Therapeutics. Hunter, here you are. All right.
Good to see you, Logan.
All right, it's not our first conversation, but it's a good chance for you to tell our audience what Hormone Therapeutics is all about, and how are you doing?
I'm doing fantastic. I'm having a great time at the festival. Hormone Therapeutics, we're a telemedicine platform providing specialist access to the endocrinologists and the specialists needed as people are aging faster to help them live a healthier, longer life.
Okay, break it down for me. You said, what kind of specialists are you helping? Who are you engaging with?
We have people with chronic care conditions that aren't getting access to specialists they need. So let's say men who have low testosterone. Do you know that we have a 50-year-old man has half the testosterone that his grandfather did at the same age 50 years ago because of the exogenous conditions in our environment? So we are now living 38% longer than we did 100 years ago, but with less testosterone. Testosterone is such an important part of your energy, your fatigue, your mental clarity, your sexual interest, your sexual function. And so we are living longer, but with half the levels that we had at the same age as our grandfathers did, and it's dramatically affecting people's lives. And we are providing specialist access. So a lot of people go to the primary care physician, and the primary care physician will say, okay, the normal range is 300 to 1200, you're 350, you're normal. But you have 3/4 of the 24 symptoms of low testosterone, but I'm not going to treat you because you're normal because of that. Whereas we have the experts who identified, no, you have 3/4 of the symptoms of low testosterone. We know we can help you. We know we can improve your life. We know we can get back to feeling the way you used to feel.
Okay. So I'm the guy, I came to my primary doctor, I'm 350. How do I engage with Hormone Therapeutics? How is my life different?
You reach out to us. We are going to send a phlebotomist to your home or send you to a local lab testing facility. We'll get those test results back. We do deep kind of medical questionnaires to understand you, teleconsultations, and then we will design a program to get you back on your life. And then we have a monthly program where you are receiving the medications, and we're teaching how to self-administer them. And so if you're in New York, you have access, or Beverly Hills, you have access to these type of doctors. 88% of the country is medically underserved for basic care, let alone access to specialists. And so these people going to the primary care physicians, these guys are telling them you're normal. And like, no, I know I'm not normal. And so we're providing them access to the type of specialists who can help them recapture their lives.
Interesting. Is there a stigma around this? Is there sort of another side of the challenge here to sort of educate?
Education is a big part of it. So one, just like reaching out about things, whether it be sexual function or fatigue. These are, people have a tough time talking about that. And then also when your doctor doesn't really understand kind of the depleted endocrine system and what that does to you, that really is, it's difficult to have that conversation. But here's another important stat, like 83,000 US veterans with low T, once they got boosted up to normal levels, they had lower incidence of heart attack, stroke, prostate cancer, and mortality. So the growing understanding that living with a depleted endocrine system not only affects those 24 symptoms, but also a lot of downstream negative effects that we're only really starting to understand that what's going to happen to you if you don't kind of regulate and optimize your endocrine system.
Why do you think that was such a gap in the market? I mean, that seems like a clear problem.
50 years ago, there was a study that was done wrong, and they showed that there was an increased risk for prostate cancer for anybody supplementing testosterone. They went back and looked at that study and found out that study was read wrong. Now they know that if you supplement your testosterone to normal levels, you're going to lower your chance for prostate cancer. You just don't want to be on a program if you do have prostate cancer. And then there's also a real stigma around kind of the people who have abused it in the 70s and 80s, athletes, wrestlers, bodybuilders, and so they abused it, and so there's a real strong kind of a stigma attached to the people that we're aware of in these programs.
So there must be an education component that you're working on to sort of break down some of those misconceptions.
That's exactly right. It's really helping people understand it's not normal. It may be normal to do that, but it's something you can do about it. So it's like a doctor telling you, okay, you're 50, and when you're 20, your vision was 20/20. Now you have the normal vision for a 50-year-old, but don't you want to have normal vision now? And so,
and not offer you glasses.
Yeah, and so it's really just helping them to understand this can be treated. And so it's a big educational component. And the biggest thing is get in, get tested, understand what your options are. And if the symptoms aren't a problem to you, there's no reason to deal with it. But if you're dealing with the problems associated with low testosterone, it's really easily remedied.
Awesome. Okay, so 2020, what are you most excited about? What are the milestones you're looking ahead for?
Yeah, we had a great 2019. We had 9 record months. We had 11% month-over-month growth. We're not raising capital right now. We're growing organically because of the interest from the patients. So this year we're going to be. I'm really excited about the growth functions, but there's a lot of other things associated around the testosterone programs that we're going to start adding. supplements, health coaching, diet coaching, nutritional analysis. So there's a number of things that we're going to help with people to optimize their lives, really around healthier aging.
Awesome. Hunter, great to have you down at the Startup Health studio. Wish you an awesome 2020 and a great rest of the festival.
Thanks, Logan. Appreciate
All
it.
right.